Seoul's Education Ministry has unveiled its medical school quota guidelines for the academic year of 2025, and the medical arena is reaffirming its strong opposition. Our Kun-woo has more.
Admission guidelines for the increased medical school quota in South Korea next year were announced by the Education Ministry on Thursday. The guidelines include a total increase of 1,497 students compared to the year before, across 39 colleges nationwide. The new total is 4,610, and the figure is irreversible. Specifically compared to the year before, around 900 more students living in non-capital regions will be able to enter medical schools located where they live. Colleges are expected to release their own detailed guidelines as scheduled on Friday to reflect the fixed quota. The Korean Medical Association responded by saying it would hold a candlelight rally Thursday night under the slogan of "A death sentence for the Korean medical system" to protest against the government's plans that they say have led to the collapse of the medical system. These rallies will be held in areas across the country, including Seoul, Busan, and Daegu. On Wednesday, the government reiterated its calls for junior doctors to return to work, noting some have already done so, while also saying doctors who go back to work now will face fewer penalties.
Don't hesitate and return to your hospitals for your patients, your fellow medical staff, and also your future. The government will do its best to keep penalties on those who return at a minimum. There will be firm differences between those who return and those who do not.
Nearly 700 trainee doctors working at 100 major training hospitals were reported to be at their workplaces as of Tuesday, an increase of 122 compared to last month. Looking at all 211 training hospitals nationwide, around 7% of the total number of trainee doctors are currently working. Also on Wednesday, Prime Minister Han Duck-soo said an additional $56 million of funding had been agreed at a cabinet meeting the day before for hospitals to bolster their emergency medical services. That's on top of the $94 million already given to support recruitment, salaries, and running costs. The additional funds will be used to support extra pay and educational fees for nurses who have been filling in for doctors under the supervision of consultants. Kun-woo, Arirang News.